Hello, I'm Dr. Maurie Markman from the University of Texas MD Anderson Cancer Center, and I wanted to briefly discuss a very interesting paper that appeared in the Journal of Clinical Oncology, February 20th, 2009 issue, which discussed the risk of secondary cancers in women after a diagnosis of squamous cell carcinoma or adenocarcinoma of the cervix. Clearly, these two cancers are very well recognized now to be related to HPV infection, and the effectiveness of a novel vaccine approach in ultimately preventing this group of cancers has been well documented. Less discussed is the potential risk of other cancers that are not in the cervix in women who have had adenocarcinoma or squamous cell carcinoma of the cervix. What this study very nicely demonstrated is that women who have developed either of those cancers have a statistically significantly increased risk of developing secondary cancers, in particular smoking-related cancers. In fact, there was almost a double risk of smoking-related cancers. This is not terribly surprising in view of the fact that we know that smoking is a risk factor for cervix cancer, but I think the study very importantly points out the magnitude of that risk. And therefore, clearly women who have been documented to have one of these cancers need to be followed for many years in a surveillance mode, particularly related to the risk of developing cancers that are smoking-related. I encourage you to read this very interesting paper, and clearly it gives some guidance as to follow-up surveillance in this patient population. Thank you for your attention.